Our next speaker is Holly Schenzel. Holly's a nurse practitioner in our group. She's an instructor of medicine, Mayo College of Medicine. She's done extra training in psychiatry as well as geriatrics. She's a key leader on our geriatric service in hospital medicine, and she has the unfortunate spot in our office sitting right next to my giant mess. So Holly's going to come and give some geriatric patient pearls for us. So please welcome Holly.
Thank you, and welcome back from lunch. I hope everybody enjoyed their time out and a nice break. So we'll get started. I have no relevant financial disclosures or any off-label use. As far as our objectives, I'm hoping by the end of this presentation you'll be able to identify tools and resources to assess geriatric patients, describe evidence-based practice guidelines to improve patient outcomes in the geriatric population, and also demonstrate an understanding of evidence-based practice guidelines with some case studies that we'll go through. And this is just a quick overview of what we're going to go through. We're going to talk about what is all incorporated in a focused geriatric assessment, review some evidence-based practice guidelines to help you with your geriatric patients, and then work through some patient case studies. So why focus on geriatrics? Andy kind of already talked. I have a passion for geriatric patients. I'm on the geriatric service quite a bit at Hospital Internal Medicine in Rochester. But also, as you guys are aware, most of our patients are geriatric. Patient population is growing and it's aging. Patients are becoming more complicated, higher acuity, there's multiple comorbidities. So it's important that we look at these patients in a different way and individualize our practice towards them. The other reason I really like to focus on geriatrics and why I enjoy it is because a lot of their presentations are atypical. Patient can present as that quote-unquote altered mental status from that famous outside hospital or from a skilled nursing facility, or it may be in your outpatient clinic. So looking at whether it's a urinary tract infection, is it a stroke, is it just electrolyte abnormality? So we'll look at some of those cases that. The other thing is it's a privilege to take care of patients, but it's also a special privilege and honor to take care of these elderly patients. They have such experience to share, and it's a joy. And then just that the consideration is beyond the person. Similar to pediatric patients, it includes the family, especially if a patient doesn't have the capacity to make their own decisions or they have a neurocognitive disorder. So let's get started first about some biology of aging.